Billy Milligan. He was arrested and imprisoned in Ohio in 1975. He was charged with armed robbery. 2 years later, after being released on parole, Billy was arrested and charged with raping 3 women. When he committed his crimes, Billy was diagnosed with multiple personality disorder, now known as dissociative identity disorder. He claimed to have 24 personalities living inside him and said he was under the influence of two personalities, the Yugoslavian Reagan and the 19-year-old Adlana, when he committed the crimes. Billy said he had no memory of the crimes since they were committed by other personalities. Billy Milligan was found not guilty by reason of insanity. He spent much of his adult life in state-run mental facilities. About his childhood, his father, Johnny Morrison, was a gambler and also an alcoholic. Johnny Morrison was under huge debt and suffered from depression, due to which he committed suicide. After his father's death, Billy witnessed his mother dating different men who were abusive to him. At the age of 6, he was raped by one of his stepfather. This was Billy's dramatic childhood that led him to develop unusual personalities in his mind. On 2014, Milligan died of cancer at the age of 59. Several books were written on his biography and many directors decided to make a film. Now let's have a look at the disorder in detail. Dissociative disorder. The word dissociation means to be disconnected from others, from the world around you, or from yourself. The term dissociative disorder describes a persistent mental state that is marked by feelings of being detached from reality, being outside of one's own body, or experiencing memory loss. Types. There are three primary types of dissociative disorders. Dissociative identity disorder. This disorder was previously referred to as multiple personality disorder. It is characterized by more than one identity present in one person. Depersonalization or derealization disorder. Depersonalization. People may feel as if they are outside their bodies and watching events happening to them. Derealization. People may feel as if things and people in the world around them are not real. And the third type is dissociative amnesia. It is characterized by an inability to remember personal information in a way that cannot be accounted for by forgetfulness. Symptoms of dissociative identity disorder. The existence of two or more distinct identities or personality states. Each identity has a particular set of behavior, attitude, preferences, memories, and ways of thinking that are observable by others and may even be reported by the affected person. Shifting from one identity to another is involuntary, sudden, and can reverse at a moment's notice. So, having several distinct identities is symptom of dissociative identity disorder. Then, memory gaps about everyday events and personal information. Long-term gaps in memory concerning everyday events, personal information, or traumatic events of the past. Problems in social settings, the workplace, or other areas of functioning in daily life. The seriousness of such problem can range from minimal to significant. Suicide attempts, self-mutilation, and other self-injuring behaviors are common among those with dissociative identity disorder. Now, symptoms of depersonalization or derealization disorder. One or both of the following conditions exist in the same person in a recurring pattern over a long period of time. Depersonalization. Feelings of unreality or of being detached from one's own mind, body or self. It is as if one is an observer of rather than a participant in their own life events. They feel like they are watching their life from outside. Then derealization. Feelings of unreality or of being detached from one's surroundings. People and things may not seem real. During these episodes, the person is aware of their surroundings and knows that what they are experiencing is not normal. Even if the person shows little emotion during these episodes, they are usually interpreted as being quite upsetting. Symptoms may start as early as childhood, with 16 years old being the average age of first experience. Fewer than 20% will have their first experience of the disorder after the age of 20. Symptoms of dissociative amnesia. The main symptom is memory loss, that is more severe than normal forgetfulness. The person won't be able to recall information about himself or events and people in their life, especially from a traumatic time. Someone with dissociative amnesia will have periods where they cannot remember information about themselves or events in their past life. They may also forget a learned talent or skill. The gaps in memories are much more severe than normal forgetfulness and are not the result of another medical condition. Some people with dissociative amnesia find themselves in a strange place without knowing how they got there. They may have traveled there on purpose or wandered in a confused state. These blank episodes may last minutes, hours, or days. In rare cases, they can last months or years. There are three types of amnesia. Localized. In localized, cannot remember an event or period of time. Most common form of amnesia is localized amnesia. Then selective. Cannot remember certain details of events about a given period of time. Then generalized. It is a complete loss of identity of life history, and it is the rarest form of memory loss. Causes. Traumatic experience such as abuse or neglect. When the mind is confronted with horribly disturbing and traumatic experiences, one way of coping with these events is to separate the awareness of them from the rest of one's consciousness. Family history. Having a family history of dissociative disorder, there is some evidence that genetic factors do account for about half of the risk of having dissociative experiences. Then, stress. Experiencing a great deal of stress in your life. Under stressful situation, stress hormones like cortisol can alter the functions of the hippocampus and impair memory, encoding and retrieval, which may account for dissociative amnesia. Using certain drugs or alcohol. Certain drugs like ketamine, PCP, and hallucinogens are known to cause dissociative symptoms. Adolescents tend to have dissociative experiences more often than adults and also tend to experiment frequently with psychoactive substances. Diagnosis. Diagnosis of dissociative disorder involves a review of symptoms and the person's life history. Physical test. It may be performed to rule out physical or medical conditions that could cause symptoms such as memory loss or feelings of unreality. Such conditions might include head injury, brain tumor, sleep problems, or drug or alcohol use. Once these physical causes are ruled out, A mental health specialist will step in to analyze the details of the individual's case. Psychiatric examination or psychological analysis. The mental health professional asks questions about the person's thought, feelings, and behavior and discuss the symptoms. With the permission, information from the family members or others may be taken. Then use of DSM-5 criteria. The mental health professional compare the symptoms to the criteria for diagnosis in the DSM-5. Management. How to treat the dissociative disorders. Doctors may recommend psychotherapy and medication to help manage associated symptoms. Types of psychotherapy that may be used to treat dissociation include cognitive behavioral therapy, CBT. It focuses on helping people identify and change negative thoughts and behaviors. Dialectical behavioral therapy or DBT. It helps people learn skills that allow them to better manage emotions and stop harmful behaviors. Eye movement desensitization and reprocessing, EMDR. It utilizes CBT strategies along with the visual exercise to help reduce psychological distress. Medication. Doctor prescribe medications such as antidepressants, sleep aids, and anti-anxiety drugs to help manage problems with mood, anxiety, or sleep. If the dissociation is due to a psychiatric condition such as schizophrenia, then the doctor may also prescribe an antipsychotic medication. How to cope up with the dissociative disorder? Some strategies that can use to help cope with stress and anxiety that may trigger dissociation include: learn to ground yourself. That is, practicing grounding techniques that can help bring you back to the present moment. Grounding yourself simply means finding ways to be present in the current moment. Grounding techniques includes breathe in and breathe out deeply, recite a poem or a song, look for a way to make yourself laugh, splash cold water on your face, or sit with a pet. Then relaxation strategies. It helps to cope up with stress. The strategies like yoga and meditation can be used. Physical exercise. Getting regular physical exercise is an effective way to deal with nearly any medical health problem. It is also a good way to take care of your physical health. Dancing can be a great way to focus on the moment, as can going for a quick bike ride. Then know your triggers. Identifying and avoiding or managing the triggers. By identifying the things that trigger your dissociative disorder, you can take the steps you need to prevent it. This can be done by either limiting your exposure to triggers or creating ways to cope with them. In addition, make sure getting adequate sleep each night and ensure eating a healthy diet. Hope you like this video on dissociative disorder. Please subscribe the channel for more videos on related contents. Thank you and keep smiling.